Who is Accreditation Canada? What is accreditation, and why is it even important?
Well, Accreditation Canada is a standards organization in healthcare. It's a national organization, of course, and healthcare organizations, almost all healthcare organizations in the country, are voluntarily members of Accreditation Canada. It has standards that organizations like Eastern Health have to meet in order to be seen to be providing good quality care.
So essentially, it's a stamp of approval.
It is a stamp of approval, that's correct.
Eastern Health was accredited 4 years ago, but this time Accreditation Canada went a step further in its report and gave Eastern Health the designation of Accredited with Commendation. How significant are those words, with commendation?
So we're absolutely delighted to have received the second highest accreditation award that we could from Accreditation Canada. It means external surveyors, so 10 folks from jurisdictions all across the country who come in and look at the standards, look at what we're doing in Eastern Health, and grade us on those standards. They visited programs in 21 sites across Eastern Health. They talked to leaders, to frontline staff, and to patients actually as well. They observed care happening within Eastern Health. They looked at our policies. They spoke to people and asked about their experience. They come in and see how we're doing and how we match up against those standards, and then we get a grade. And so our score this time round was 97%. And what that means is out of the 4,300 standards that they assessed us on, in 97% of those cases we met or exceeded the standards, which is, again, a fabulous result. I'm absolutely delighted as the CEO to be leading an organization that is 97% compliant with best practices across the country. In a number of areas, the accreditors talked about some things that they were very pleased to see. The depth of our strategic planning and the focus on quality and patient safety, they recognized as a very positive thing compared to other organizations they've visited. Our focus on workplace health and safety, the work that we've done on patient flow and how we get people through our buildings now, and which has resulted in less cancellation of surgeries, as an example. We're doing some very good work in medication reconciliation, and they recognize that. So they highlighted quite a list of things that were very positive, but of course there's lots of work to be done. They did talk about client and family-centered care, which is a big focus in best practices in healthcare organizations. We're doing a lot of work with committee structures and involving patients and families in advisory committees, for example. How we involved them in the strategic plan was seen to be a positive, but we know we have a lot more to do in that regard.
Eastern Health has approximately 1.5 million interactions every year with our patients, clients, and residents. What should the words accredited with commendation mean to them?
When you have colleagues from across the country, from different jurisdictions, or big organizations and small, come in and evaluate what we're doing in Eastern Health and say you're 97% compliant with best practices and standards across the country, I hope it gives patients and families comfort that when they come into Eastern Health and they get a service that's going to be very high quality, they're going to be well received in the organization, and their experience is going to be a really good one. One of the other things we were really pleased with is comments from the accreditors on how impressed they were with some of the work that's happening in primary care. And lots of our staff would be aware we've been doing a primary care pilot project on the Bonavista Peninsula, and it's something that we're very pleased with. And anytime we have an opportunity to speak to anyone from away, anyone prepared to listen, we always focus on the community engagement, the fact that the community has rallied around and given us lots of good feedback on how we can improve primary care in Bonavista. We've implemented an EMR, an electronic medical record, and lots of technology, remote patient monitoring, and our team has come together there, and we just think that what the work that's happening in the Bonavista Peninsula, we think internally, is quite fantastic, and it was really good for us to hear that that's also very impressive work for the folks that came and did the accreditation.
What does 97% compliance with national standards of excellence mean to 13,000 men and women who work at Eastern Health?
Well, as we've said earlier, we see this as an affirmation that we're on the right track. So the work's not done. There's lots to be done, and it's the way it is with standards in any organization. As soon as you attain a certain level, then the standards shift, and the thinking shifts, and the technology shifts, and so it's an ongoing conversation in the organization. We're aiming to be an organization that continually improves, and I think what is really rewarding about this is to see a score that we haven't seen before, which shows that we have improved, and our goal in the next 4 years will be to improve even more.
Well, thanks for your time today.
Thank you.